Imagine a world where your doctor prescribes a life-saving surgery only for a line of code to say no. This isn't science fiction, it's the current reality for millions. For decades, the American healthcare system has struggled with efficiency and cost, but a new player has entered the arena: artificial intelligence. Insurance giants are now deploying sophisticated algorithms to process claims at speeds no human could match. However, reports are surfacing that these tools are being used not just to streamline the process, but to systematically deny care to those who need it most. We are seeing a shift from medical expertise to mathematical probability, leaving patients caught in a bureaucratic nightmare. Today, we investigate the black box algorithms causing chaos in healthcare, the legal battles unfolding in federal courts, and what this means for the future of patient rights.
At the heart of this storm is an algorithm known as NH-Predict. Developed by NaviHealth, a subsidiary of United Health Group, this tool was designed to predict how long a patient would need post-acute care, such as stay in a skilled nursing facility. While the software claims to personalize recovery timelines, lawsuits allege it sets rigid, arbitrary limits. Instead of listening to a physical therapist's report on a patient's progress, the AI provides a predicted discharge date based on historical data. If the patient isn't ready to go home by that date, the insurance coverage simply stops. This has led to vulnerable seniors being discharged prematurely, sometimes with devastating health consequences, all because a computer model decided their time was up.
Internal memos and whistleblower testimonies have revealed a startling lack of human oversight. In some cases, medical directors at insurance companies were reportedly spending as little as 1.2 seconds reviewing a claim before upholding an AI-generated denial. The pressure to maintain efficiency metrics has created a conveyor belt of denials. Documents suggest that the algorithms are tuned to be aggressive, favoring the bottom line over patient outcomes. This isn't just about speed, it's about a fundamental change in the definition of medical necessity. By automating these decisions, companies can process thousands of claims in the time it used to take to review one. But the human element, the nuance of a patient's specific condition, is being lost in the digital shuffle.
The most shocking statistic in this unfolding scandal is the success rate of appeals. Data indicates that when patients or doctors fight back against these AI-driven denials, they win approximately 90% of the time. This suggests that the initial AI decision is overwhelmingly incorrect when held up to medical scrutiny. However, the catch is that very few people actually appeal. The process is designed to be exhausting, requiring hours of paperwork and phone calls that many sick or elderly patients simply cannot manage. For the insurance companies, even if they lose 90% of the appeals that are filed, they still save millions on the vast majority of claims that are never challenged. It is a war of attrition where the AI is the front line.
To understand why this is happening, we have to look at the financial incentives. Major insurers have seen record profits as they integrate AI into their operations. By reducing the number of days spent in rehabilitation and denying expensive diagnostic tests, these companies significantly lower their expenditures. For shareholders, this is a success story of digital transformation. But for the medical community, it is a crisis of ethics. Doctors are finding themselves in the position of arguing with machines rather than colleagues. The friction between a healthcare provider's duty to their patient and an insurer's duty to its bottom line has never been more visible. We are seeing a systemic shift where the goal is no longer to provide care, but to manage costs through predictive modeling.
The legal system is finally starting to catch up. In late 2023 and early 2024, a wave of class action lawsuits was filed against United Health and Humana. These lawsuits allege that the companies used AI to override the judgment of medical professionals and to intentionally deny coverage for care they knew was necessary under Medicare Advantage rules. The plaintiffs are not just looking for reimbursement, they are seeking to change the law. They argue that using an algorithm to make medical determinations without meaningful human review is a violation of the contract between the insurer and the insured. These cases could set a precedent for how AI is used across all sectors of the economy, but in healthcare, the stakes are literally life and death.
A significant portion of these AI denials are occurring within Medicare Advantage plans. These are private insurance versions of Medicare that are funded by the government but managed by private companies. While they often offer lower premiums or extra benefits, the managed part of the care is where the AI comes in. Federal regulators at the Centers for Medicare and Medicaid Services, or CMS, have recently issued new rules to curb these practices. They specify that AI cannot be the sole basis for denying care, and that insurers must take the individual patient's circumstances into account. However, enforcing these rules in a system that processes millions of claims daily is a monumental task. The question remains, can the government move fast enough to protect seniors from the speed of the algorithm?
While the focus today is on the United States, this is a global trend. From Europe to Asia, healthcare systems are looking at AI to manage aging populations and rising costs. However, different regions are taking very different approaches to regulation. The European Union's AI Act, for instance, classifies AI used in essential services like healthcare as high risk, requiring strict transparency and human oversight. The U.S. approach has been more fragmented, relying on lawsuits and piecemeal regulation. The chaos we see in the American system serves as a warning to the rest of the world. Without clear boundaries, the efficiency of AI can quickly turn into a tool for exclusion. As we integrate these technologies, the priority must remain on the human being at the other end of the code.
The current controversy involves predictive algorithms like NH-Predict, but the next wave of AI, large language models like GPT-4, is already being tested for clinical use. These models are much more sophisticated, capable of drafting medical notes and even communicating with patients. The potential for good is enormous. They could help doctors catch rare diseases or manage chronic conditions more effectively. But the risks are equally large. If an LLM is trained on biased data or programmed with the same cost-cutting incentives as previous algorithms, the denial machine could become even more persuasive and harder to detect. We are at a crossroads where we must decide if AI will be a tool that assists doctors or a system that replaces them.
The chaos caused by healthcare AI policies is a wake-up call. It reminds us that technology is never neutral. It reflects the values of those who build and deploy it. If we value profit over people, we will get algorithms that deny care. If we value health and dignity, we will demand systems that are transparent, accountable, and overseen by human experts. For patients and their families, the message is clear. Be prepared to fight. Know your rights, understand the appeal process, and don't take a no from a machine as the final word. As citizens, we must advocate for laws that ensure AI is a partner in our health, not a barrier to it. The future of healthcare is being written in code right now. Let's make sure it's a future we want to live in.